Hello, everyone, and welcome again to another Max Talk. Joining us today is Dr. Amod Manocha, Head Pain Management Services here at Max Super Specialty Hospital, Saket. Hello, Doctor.
Hi.
My first question here is that we have seen an increase in neck and back pain among people during the pandemic era last year. So, what was the main reason?
Okay, so I can subdivide this problem into two sections. One is people who have had pain before and they're coming with increased pain after the COVID. And the second is people who've got new onset pain. So for the people who've had pain before and they're coming back, it's predominantly because they've not been able to access healthcare. They've been ignoring problems or avoiding going to the hospitals. And then the big section is the people who have got new pains. And I put this to a change in lifestyle. Like these neck, back pain, and all these similar problems, the lifestyle has a huge component in these, and you can call these as lifestyle diseases also. So if you analyze what's been happening during the COVID, people's life has changed significantly. Whether it's work, people are working from home, which means they don't have their familiar office environment and the ergonomically designed chairs and desks. So a lot of people have been sitting in bed and doing their work, or sitting in dining tables and doing their work. Instead of desktops, they've been working more on the laptops. The working hours have gone haywire, whether they're working long hours or more often. So all these things, the work environment has changed significantly, which changes your lifestyle. And then the home environment for the homemakers has also changed. A lot of people don't have any help, so they had to undertake new tasks like shifting furniture, cleaning their houses. A lot of people have used this time to change their activity levels, whether they've become more active and taken to exercises, or they've become sedentary because they can't go to the gym. So again, this brings us to the changes in lifestyles. And then not to ignore the component of weight. The weights of people has changed a lot. Some people have not been exercising and they've been gaining, whereas other people have used this opportunity to become fitter. And again, the weight has changed. Some people have given up things like smoking, where others have taken up these new things because they've had a different level of stress. So all these things have changed the lifestyles of people. And I think for problems such as neck and back pain, lifestyle is a very important thing, and we can't ignore it.
Doctor, coming to lifestyle changes, one thing that we have noticed in the past 5 years, I would say, that a lot of younger people have been affected with back pain and neck pain issue. Is there a increase in rate of younger people being affected with this?
Okay, again, yes, you're right. That's the short answer. And there is research evidence indicating that there is increase in back and neck pain. There is a global study which is done every few years, and that has shown between 2006 and 2016, there's been a whopping 21% increase in the incidence or prevalence of neck and back pain, which is persisting for a long time. And what's happened in all these years? More laptops. Young people, are becoming more career-oriented. They're spending more and more time behind the screen, and that has a huge contribution to make. And even the COVID times have magnified these changes a lot further. There are a lot of other studies which are coming up after COVID, which are showing that the incidence of these kind of pains is significantly increasing. And younger people, because they're more ambitious, they work lots more, and that's why it's affecting more and more of younger people, I think.
So, Doctor, हमने अभी बात करी younger people के बारे में and pandemic के time पे lifetime changes. Work from home के दौरान, how can we prevent neck and back pain?
Okay, there are simple pointers towards what we can do. Simple things like being mindful of your posture, अपने posture का ध्यान रखना, आप कहाँ बैठ करके क्या काम कर रहे हैं. जैसे कि there is थोड़ा सा ऐसा एविडेंस है कि अगर आप लैपटॉप्स यूज़ कर रहे हैं लॉन्ग आवर्स के लिए और आपका उसका हाइट एडजस्टमेंट के लिए कोई डिवाइस नहीं यूज़ कर रहे हैं, स्पेशली अगर आप 7-8 घंटे से ज़्यादा दिन में ये काम कर रहे हैं तो उससे नेक पेन का इंसिडेंस बढ़ता है. सो दैट इज़ वन थिंग कि अपने पॉस्चर पे जहाँ आप बैठ के काम कर रहे हैं उसके बारे में माइंडफुल होना. उसके अलावा सिंपल एक्सरसाइजेज, अपनी एक्टिविटी को मेंटेन करना, इट गोज़ अ लॉन्ग वे. उससे काफ़ी मदद मिलती है मसल्स को एक स्ट्रेंथ लेवल मेंटेन करने में. उसके अलावा अगर आपको कोई नया काम करना है या कोई जैसे घर की सफाई करनी है तो इट इज़ बेटर टू डू इट पीस मील, मतलब थोड़ा तोड़ करके रोज़ थोड़ा थोड़ा काम करें, जिसे हम पेसिंग कहते हैं. इससे बहुत फ़र्क पड़ता है. उसके अलावा जैसा कि हमने पहले बात करी, लाइफस्टाइल का तो बहुत बड़ा कंपोनेंट है ही. हेल्दी डाइट खाएंगे और थिंग्स लाइक स्मोकिंग, जिनके साथ ये सारी बीमारियां जुड़ी हुई हैं, उनको छोड़ना ज़रूरी है. और अगर आपकी कोई प्रॉब्लम है तो उसको इग्नोर नहीं करें और उसके लिए सही समय पे एडवाइस लें, क्योंकि बहुत सारी ऐसी कंडीशंस हैं जिन्हें समय रहते कंट्रोल किया जाए तो वो अच्छे से कंट्रोल में आती हैं, लेकिन लंबा छोड़ देने पे वो ज़्यादा परेशान करती हैं.
सो डॉक्टर, कौन सा समय सही होता है डॉक्टर को दिखाने के लिए? अगर आपको पेन महसूस हो रहा है और आपको लग रहा है कि मुझे डॉक्टर को दिखाना चाहिए, व्हेन डू यू एडवाइस वन शुड सी अ डॉक्टर?
ये बहुत ही अच्छा सवाल है और इसको मैं हम यहाँ पे नेक और बैक पेन पे ज़्यादा फोकस कर रहे हैं, बट मैं इसको एक जनरल पेन की तरह भी जवाब देना चाहूँगा और नेक और बैक पेन के स्पेसिफिकली भी जवाब देना चाहूँगा. तो नेक पेन के बारे में और बैक पेन के बारे में हम बात करें तो अगर आपकी पेन के साथ में हाथ या पाँव में नमनेस आ रही है, वीकनेस आ रही है, टिंगलिंग आ रही है और ये बढ़ रही है, तो ये एक इंडिकेशन है कि आपको मेडिकल एडवाइस जल्दी लेना चाहिए. उसके अलावा अगर आपके चलने में, आपकी ग्रिप में प्रॉब्लम आ रही है तो आपको जल्दी एडवाइस लेना चाहिए. अगर ये दर्द चोट लगने के बाद शुरू होते हैं या इनके साथ आपका वज़न कम हो रहा है या आपको और बीमारियां हैं जिसकी वजह से आपकी इम्यूनिटी अफेक्ट हो सकती है, जैसे कि किसी को अगर कैंसर है या वो लंबे समय स्टेरॉइड्स पे रहा है, ऐसे सिचुएशंस में ऐसे लोगों को जल्दी एडवाइस लेना चाहिए. उसके अलावा एक बहुत ही अहम चीज़, अगर आपके स्टूल या यूरिन के कंट्रोल में प्रॉब्लम आ रही है तो ये बहुत ज़रूरी है कि आप उसको इग्नोर ना करें और जल्दी एडवाइस लें. ये बात हो गई स्पेसिफिकली नेक और बैक पेन को लेकर के. अगर हम जनरल बात करें तो अगर आपका पेन 3 महीने से ज़्यादा रह रहा है या वो आपकी ज़िंदगी में एक बाधा बन के आ रहा है, आपको काम करने से रोक रहा है, आपको सोने से रोक रहा है, या आपके प्लान्स हैं बार बार कैंसिल हो रहे हैं, उसके अलावा अगर उसका कारण नहीं मिल पा रहा है या आपको दवाइयाँ बार बार बढ़ानी पड़ रही हैं या फिर दवाई छोड़ने पे वो दर्द वापस आ रहा है, या आप दवाइयों से एक निजात पाना चाहते हैं, इन सब सिचुएशन में आपको एक पेन स्पेशलिस्ट की राय लेने से मदद हो सकती है. उसके अलावा एक और ख़ास चीज़, अगर आपकी किसी तरह की सर्जरी हो चुकी है और उसके बाद भी दर्द रह रहा है, वो भी एक और सिचुएशन है जिसमें एक पेन स्पेशलिस्ट आपकी मदद कर सकता है.
थैंक यू सो मच डॉक्टर. आगे बढ़ने से पहले मैं अपने ऑडियंस को बताना चाहूँगी, इन केस आपके पास कोई भी क्वेश्चन है, आप कमेंट्स में अपने क्वेश्चन डाल सकते हैं. वी विल गेट बैक टू यू, एंड इफ यू वांट टू गेट contacted and you want to have a one-on-one opinion with the doctor, you can do it by calling at the number on your screen and clicking on the link. Coming back to the question, doctor, how effective are medications when it comes to pain management, and are there any other pain management techniques apart from medication?
So medicines are a very important component of any pain management, and what you do depends upon what's the cause of the pain, right? So small minor muscle sprains often resolve with time and with a bit of support with medications. Similarly, whenever we are even controlling long-standing pain, they form an essential component. So we don't use things in isolation. In pain management, the focus is on managing you as a person. So we look at your lifestyle, we look at what you want, what is important for you, what is your daytime work. Like recently I saw a doctor and he has to be alert during the daytime, so I won't give him any medicines which will make him sleepy during the daytime. So we look at you as a person and we combine different modalities, whether that be injections, whether that be medications, whether that be physiotherapy, whether that be psychology or alternative techniques like acupuncture. There are lots of options, and what we choose depends upon what is the cause of your pain and what you as a person are and what is important for you.
Thank you, doctor. Now coming to something that is very common these days, and that is chronic pain. What is exactly chronic neck pain and what are the signs and symptoms of it?
Okay, so chronic word means which has been persisting for a while, right? So when I say persisting for a while, I mean beyond the healing capacity of the body or in the time frame when the healing is supposed to occur. If your pain's persisting beyond that, then that is what we call as chronic. So normally we take this period as about 3 months. So if you've got a pain which is persisting more than 3 months, the body should have healed. And that's what a chronic pain is. So signs and symptoms of a chronic pain, especially involving the neck and the back, you could have pain which could be localized to one point in the neck, or it could be a diffuse pain in the neck or the back. It can spread towards the neighboring areas, such as the neck pain can go into the shoulders, in the front of the chest, into the shoulder blade or the scapula. It could go into the arms. So similarly, the leg pain can go into the buttocks, into the groin area, or into your legs. So one component is the pain, which can be of different kinds. And then you can get along with that, say, numbness, tingling, or weakness of the arms or the legs, depending upon where it's coming from. Then the other problems you can get are weakened grip or problems in walking because of gait issues. And as we talked about before, you can have urine or stool problems. Sometimes when you've got a severe pain, it can even lead to nausea, vomiting, and you feeling dizzy. So these are the common things what we see with neck pain and back pain.
Thank you so much, Doctor. Doctor, before we wrap up this, what would you like to tell our audience about working from home? Any advice you'd like to give them?
So working from home, very important is pay attention to your posture. Make sure wherever you're sitting is more physiological. When I say physiological, I mean what your body is meant to be like. You make sure the table's at the right height, your chair's nice and supportive. When you are working on the laptop, don't sit in the bed and do that. And if you want to do that for some reason, there are devices which can help you raise the height of the laptop. Indulge in regular exercises, healthy diet, and healthy lifestyle.
Thank you so much, Doctor. And thank you so much for joining us. Before leaving, I would once again remind my audience that you can leave your questions in the comment section and we will get back to you. Max Hospitals are safe and green, and we will see you in the next one. Thank you, Doctor.
Thank you very much.